Good morning, dear ladies and gentlemen, dear experts, patients, physicians, journalists. My name is Zahriychuk, and today I'm going to be the moderator of this roundtable, of this press conference. And in fact, it's going to be a serious discussion regarding the humanitarian aid for patients with orphan diseases, the effective partnership between the government and the private sector. Ukraine has already done a huge step forward in order to provision the patients with rare, or by other words, the orphan diseases with needed medications and treatment, and is one of the countries in which we have a separate law which is approved and which acts regarding the orphan diseases. It was done in 2014. And Ukraine, beside that, has its own laboratory in order to diagnose this kind of diseases based on the National Pediatric Specialized Clinic Okhmatdyt. The NGO Orphan Diseases of Ukraine is the member of European organization EURORDIS, which is an alliance of 869 patients associations out of 71 countries, which work in order to improve the lives of 30 million of patients in different European countries, for those patients with the orphan diseases, of course. After the approval of the law of the rare diseases, there was some changes implemented which gave the possibility for the huge amount of patients with orphan diseases to have an access to the treatment. But also, despite this breakthrough and these steps, we have some issues and problems. Right now, we have some issues regarding the provision of the needed treatment for the patients with the orphan diseases. Because of lack of the budget costs, just 1/3 of the patients receive the needed medication. And all the orphan patients need continuous, quality, and whole life treatment. The situation is getting even worse, that the treatment of orphan diseases is really expensive, or so to say, takes a lot of budget costs. And patients do not have real possibility to pay out of their own pocket for this treatment, or even by involving any kind of supports or the society support. It is clear that in this kind of situation we have social and responsible business which helps us. And company Sanofi right now is the first company in Ukraine which for more than 15 years takes part in this sphere. It provides the humanitarian aid for patients with orphan diseases in the framework of its international humanitarian aid program, ICAP program. Company was the first one who started to treat the orphan diseases for their own costs when we were not even talking 15 years ago about the government programs, despite the fact that people were interested into this issue and it was actual. Thanks to that help which was provided by Sanofi company, patients have the possibility to live, to work, to create families. And where we have families, of course, we have children. And we have some cases when those orphan patients give a birth to the children. Right now, Sanofi provides one more provision of the medication for Ukrainian patients for the treatment of orphan diseases. And this provision costs $2.9 million of dollars. Also, we need to mention that for the period of this humanitarian aid, starting from the 2002, the Sanofi company provided for Ukraine the medication in the general cost of more than 1.5 billion hryvnias. And more details you are going to find and about the humanitarian aid program you are going to find out in your handout materials. And more details are going to be heard from our members of today's talk. And right now we are going to discuss how to build up an effective model of partnership between the social responsible business and also the governmental agencies, and not forgetting about the society. We are going to talk about it. Taking as an example humanitarian aid of Sanofi company, and by having as example those efforts that were done by the governmental agencies in order to provide the treatment for the patients. We are going to have a real representative event today. We have representatives from the Ministry of Healthcare, and also we have two representatives from the Committee of the Healthcare out of the government. We have experts. There is a person who is a patient who has orphan disease. So today we are going to have Mykhailo Zahriychuk, who is the Deputy Minister of the Healthcare of Ukraine, Artem Dubnov, who is the Deputy of the Head of the Committee of the Healthcare, Medical Provision and Medical Insurance in the government, Lada Bulakh, who is the member of the committee from the same committee, and also she is the head of the Subcommittee in the provision of epidemic safety and fighting with HIV/AIDS and socially dangerous diseases. The Director of Medical Procurement of Ukraine, Arsen Zhumadilov, Natalia Samonenko, she is the physician of the Center for Orphan Diseases in Okhmatdyt Clinic, Tetyana Kulesha, who is the head of the Community Orphan Diseases of Ukraine, Yasmina Ahrens, she is the Associate Director of Humanitarian Programs of Sanofi Genzyme, Maryna Slobodnychenko. It is really interesting for her to be here. She is a lawyer, she is expert in the private sector. And also Mykhailo Martinenko, who is the patient with the orphan disease of the Gaucher disease, who receives the treatment according to the humanitarian aid costs. And more details are going to find out in your handout materials. We do not have a lot of time, dear colleagues, because we would like to have 20 minutes in the end of our discussion to have the Q&A session with the audience, and maybe you, after you are going to give your theses as the members, you are going to have your own answers, you're going to have your own questions or comments. That's why I'm going to define that we are going to give our talks for 5 minutes for us to have the further possibility to give more talk. And I'm going to give you one question to each of the representatives, but it doesn't mean that this kind of questions are going to be really easy. So we are going to start with the Deputy of the Ministry of Healthcare of Ukraine, Mykhailo Zahriychuk. So how do you evaluate the today's state of the provision of the patients with orphan diseases? What's your further strategy? Maybe you have it already developed, or you developed in the Ministry of Healthcare. And what's your vision of effective model of cooperation of governmental agencies and social responsible business? 5 minutes, please. Yes, the mic is working. Thanks for your question. Dear colleagues, dear friends, good afternoon. Let me just congratulate you and to say thanks to the organizers too for the possibility for the social discussion of this really important topic. As the representative of the new team of the Ministry of Healthcare, and our team is in the ministry for 1.5 months, we analyzed the state of a lot of issues, and the situation with the orphan diseases at the moment is really in dangerous spot, is crying. The state should help the patients with the orphan or rare diseases. That's the function of the government, the function of the state. The other way around, why do we need to have the government? In case patients need this high expensive treatment and the government doesn't support. That's why the first point, the issue of treatment of orphan diseases, is one of the main priorities right now. The next question. At the moment, me, as the representative and the deputy of the healthcare who is responsible for the curative work, I should say and to report to the society, to you and to the media, that the general state of orphan diseases, me as a physician also, first of all as a physician, as the deputy of the minister, I am not satisfied with it. I'm going to explain. At the moment, I do not see any kind of register of all orphan diseases, and also the amount of the patients who have one or another orphan diseases. That's why we do not have the possibility to calculate the costs which are needed in order to spend for the orphan patients. I'm going to underline once more, the government should do it, and we are going to apply all the efforts in order to support and to provide them with the treatment. The next one, I'm going to say thanks to all the NGOs, to all the society organizations, thanks to which, for a couple of the last years, government had the possibility somehow to pay attention to this category of patients. With the orphan disease patients regarding one or another data, I do not get it from not the main specialist, but I get this data and statistics from the representative of the NGO, which comes crying and says, we have 50 patients, please help them. In case you're going to ask them, and you have this right to ask me, what's the situation in the orphan disease? Me as the profile deputy, I should ask the main specialist in this field, because that's treatment. That's what I would like for you to understand. Curative, that's not politic. But we had the change of the terms by the prior team in the Ministry of Healthcare. And regarding the key treatment roles, we had people which do not know how to do the curative process in general and don't know how to do it. That's why the Institute of the Main Specialist of the Ministry of Healthcare was just damaged regarding the therapeutic approaches, surgical approaches, and we do not have a strict situation. What is going on right now in the healthcare? 1 minute left, sorry, yes. That's why I'm going to ensure you that we are going to do everything in order to have the structure of this system. We fight with corruption, and it is a huge issue. We have people fighting with us which define the politics without knowing nothing about medicine, without medical education, which has never seen patients in inpatient facilities, but they define what kind of medication should be bought, how to use it. These are just incredible facts regarding the destroying of all kind of statuses of medical approaches. That's why we do and we cooperate with the scientific teams and with the experts in order to define the curative approaches and ways. The profile specialists should do it, but not the NGOs. They should not define it. Any kind of other representatives. NGOs, thanks you a lot. Please take part in this procedure, but the politics should be done by physicians who know how to work with it. I hope that I was not giving anyone any kind of issue, but still, expert committees, institutes, scientific committees, we are going to involve all the experts. But for me, expert, this is a physician who treats the patient with the orphan disease, 19 seconds left, and not the one person who has ever read about it. Do you get the point? That's why we are going to have physicians, and me personally, there was one person out of the expert committee who is going to be responsible for orphan diseases, because it should be a really professional approach. In case this medication is expensive and it is needed, yes, it should be bought. Yes, sorry, Mykhailo, you fully understand. So the question should be yes, but despite your knowledge, you also have your passion with which you are giving your talk. But right now, just 30 seconds in order for you to say regarding the cooperation with the social responses business. That's what we didn't hear about. Of course, we are going to develop, and we started to develop a program regarding the cooperation with the social responsible business. You may have seen that the budget right now covers, we cannot cover all the needs. That's why Sanofi company and all other responsible business sectors, we do not ask just, we involve, and we would like really to thank for these efforts and for this support. That's why this partnership with business, this is the mechanism which for the next few years is going to help us to make the status of the situation equal, so to say. Thanks, Mykhailo, thanks. Of course, the private and governmental partnership is really important, but the issue is whether it is protected and formalized. But we are going to hear that from the lawyer's point of view. And right now we are going to address to Artem, Dubnov and Lada Bulakh. probably because you are the heads of the subcommittees, you are going to have really specific questions. Yes, we are going to give answers together, and you are going to have 10 minutes time for two of you. So the question is, regarding the priorities in the development of the healthcare system, and what kind of changes you need to implement in the legislation in order it to be effective as the model of the cooperation between business and private and governmental sector. Good afternoon. I would like to greet everyone on the rights of the committee of the government. In fact, I would like to say that this meeting is really important, and I am really happy that this situation is happening. For the last few years, the communication between patients, between the NGOs, and between other social responsible business regarding the orphan diseases, it was absent. It was not going on. The only thing was that everyone who was in charge, they said that there is a law. Yes, we will have a law. On the 15th of April, there was a law approved, order approved. And Ukraine is one of the small amount of countries who have the legislation in order to regulate the policies of the healthcare and the prevention of the orphan diseases. But the question is that this question is really general one. And this law is not really implemented. We have a law, but we do not have the implementation, so to say. But answering your question, this question is, and this issue is really important and actual. And when we think about the health care of our population in Ukraine, we cannot cover those patients who are left with these really severe diseases. We should cover them, and also to cure them and to treat them. A lot of expenses needed. That's why we really need a systematic approach. We need strategy to be developed. What are we going to do to treat those kind of patients? And that's why we developed this strategy of 2020-2025. In this strategy to have our vision of treatment and for the life and the health of these patients did not be in correlation of our subjective wishes or of the government. Of course, we understand that the needed approach in developing this kind of vision, we need to have a register established. We need to understand the amount of those patients and what kind of diseases are present. Because in order to have the budget costs to be calculated without knowing this data, it is impossible to do it. Of course, we say that we need to work. We have Okhmatdyt laboratory, which has the possibility to do the laboratory analysis, and we need to understand that we need to expand the list of screening procedures. In case you know, Okhmatdyt right now does only 4 screenings regarding the orphan diseases, but in the United States they do 68, for example. That's why we need to expand this list in order to understand of problems, issues, and to understand the amount of our patients. Of course, in the committee we've discussed, and we had meeting with the budget committee, and we discussed that we need to develop the budget program. The separate line in our budget for medication, that's not really effective. We need to understand what amount is needed in the short term, or we need to plan in our budget in order to ensure the treatment for the patients. And also, when we talk about the 2 days meeting, we would really like to thank, and we would like really to have all the efforts to support those social active companies that for the last 17 years, for their own costs, were providing medications to treat our patients. And our main aim is to have a really active model of partnership, even in the fact that government right now cannot provide 100% of the costs needed, but we may stimulate our partners out of business to do it. And as the last point, that regarding the law, regarding the changes in the medications, where the main aim of which was to provide our population with the drugs which are needed for the orphan diseases, this law is approved. But it is not regulated by the orders of the Cabinet of Ministers, and that's why there are no comments. We need to fully understand that we need to regulate. Law exists. Whether it's good or not, that's another discussion for the experts, but it exists and we may use this law and we have to regulate it. We are going to address to the Cabinet of Ministers, we are going to address to the Ministry of Healthcare. Thanks, Mykhailo, that you fully understand this issue, acute issue of these diseases. In order, first of all, to make it a little bit more simple, the procedure of registration of those drugs, in case the business provides drugs for their own costs and they also need to register those products, that's a little bit strange, of course. It does not motivate those companies to do this kind of social programs. Of course, half of the time. Of course, we need to involve other companies, not only Sanofi, and by some means to motivate for the social active business to help right now the government in those issues which government cannot cover 100%. Thanks.
Булах, будь ласка, ваші 5 хвилин.
Я думаю, що ми будемо швидко, тому що 5 хвилин – це традиційний регламент роботи в нашому комітеті для виступів. По-перше, хочу подякувати всім пацієнтам, які не втрачають надію і знаходять можливості жити, незважаючи на те, що держава не реалізує їх право на життя і не забезпечує їх життєво необхідними препаратами. Я дякую вам всім, що ви є тут і що ви такі активні. Я доповню вже, в принципі, Дубнов, Артем все сказав, але я доповню трішечки, проілюструю цифрами, щоб ви усвідомлювали систему координат. На сьогоднішній день комітет оновлений на 90%. Так? Це нові люди, які мають щире бажання працювати не за політичних дивідендів, не для електорату, якимись лозунгами і обіцянками. Ми прийшли працювати з метою забезпечення громадян України права на життя, тому що ліки є засобом реалізації цього права. І робота депутатів, народних депутатів і інших депутатів, які представляють кожного з вас, це реалізовувати це право в першу чергу. В минулому році бюджет охорони здоров'я складав 95 мільярдів. В цьому році він збільшився до 108. Але навіть незважаючи на те, що загальна сума видатків держави на охорону здоров'я збільшилась, ви побачили в першому варіанті проекту бюджету від Міністерства економіки, що витрати на охорону здоров'я збільшились, але витрати на...
You may observe that the procurement for the drugs was decreased. At the same week, we had extra meeting of the committee. Right now it is called the Healthcare Committee of the Nation, where each of us had their own changes to be included. And that's right now we need to improve and to expand the financing of orphan diseases for 2.4 billions. We need 3.4 billions, but that's a minimal amount of the needed costs to provide our patients with those drugs. Separately, with the Committee of the Social Protection and the Social Policies, we highlight the issue regarding the simplifying of the procedure of the volunteering work and humanitarian aid in Ukraine. That's to reduce all the obstacles in order to get those humanitarian aid through the borders. Anything regarding that is given to any kind of humanitarian aid and the drugs, of course, and also the subject which brought these drugs to Ukraine and who provides this help aid, should add additional taxes in Ukraine, which is also making this kind of initiatives hard to fulfill. We are not just talking about drugs, we are talking about the humanitarian aid. In case it costs more than 1,400 hryvnias. And this is additional taxes which right now are needed. And maybe this some kind of tickets, or whether this the life needed on medication or drugs. So we need to define what kind of humanitarian aid is given, and we work in order to change those taxes with the tax committee and to change the social politics regarding policies regarding this issue. And I'm going to end up my talk with the phrase that all further investigations and our further talking about the budget of 2020, we should provide our patients with treatments, because all other measures, probably I'm going to say that is not so good for our colleagues. For example, the professional sport or events, the cultural ones, such as Eurovision, such as other cultural ones. I'm not saying they are not needed, but in case we are going to set up our priorities in order with all of our heart, from our heart, to have the priority a life of Ukrainian patients, I think that only by provision for 100% with the drugs, we may talk about the financing other cultural expenses in the further years in development of our countries. Thank you. Thanks, Bulakh, not only for this professional talk, but thanks for giving this strict idea that the main sin is the right for life, and without it, all other expenses do not have any sense. Arsen Zhumadilov, who is director of the state agency, medical procurement of Ukraine. So, Arsen, as far as you work, do you have any kind of strategy in your state agency? And how do you deal with those needed, which are printed right now? Whether you fill up the gaps or you do it according to your planning. Maybe de facto you have some kind of a partnership between the private and government. Thanks, Andrei, for this question. Thanks, organizers, for this kind of event. I'm going to divide your question into two parts. First of all, regarding the approval of the decision and also the implementation. Regarding the approval, we've already heard the talk from the representatives of the deputies and ministers that's correctly said that regarding the expensive orphan diseases, we need to have the register of the patients, because that's a really huge amount of costs, and we cannot allow to do it annually, whether the region's needs were procured and were provided, in order to find out whether there is extra costs or ineffective use of the costs. So that's completely truth. The second opinion is that we need to move into the national strategy of the national program. How exactly our government works with the orphan diseases, because those costs which were mentioned and that context that we have right now, that's the program 1400 regarding the provision of the population with drugs. From the evolution point of view, it was developed starting from 2003. It was really like filling the gaps, comparing with the idea that it should realize one or another strategies. Right now, according to this program, we have 40 programs of treatment. That's not just orphan diseases, but that's the whole oncology, adult and pediatric oncology. That's the cardiovascular diseases, autism, transplantology, and so on. All of those nosologies, they're in one program right now. According to this program, which was already mentioned by Bulakh, by Deputy Bulakh, there was 6.5 millions proposed for the financial support for the next year. But let's be honest, in case we need to cover 100% of all nosologies, it should be 10 billions, and we are talking about the nominal need. So the need in those drugs, in those medical devices, which were mentioned in the list. But in case we need about the real need, in fact, what we actually need in order to treat or cure the patient, or to get the treatment for the quality of life of the patient to be on the high level, then this number is much bigger. And this is a discussion that should happen. This discussion should happen in the society and in the community regarding what's the priority of the society, how do we provide those finances. This kind of this program, of government program, should involve the resources of the local budgets. We are talking about decentralization right now. We are talking that huge possibilities are available on the local level. As far as I know, local budgets are not really interested in order to be involved in the co-financing of the drugs and medical devices for the orphan patients. There are some reasons for that. The first reason is the political one. They want to spend their money regarding what was going to be observed for the elections, for example, the new bus or the new road. Also, there are some formal scenes that not all the orphan treatment drugs are not listed in the national list of drugs. So that's the first reason. So we all have a lot of things to work with. The prior Ministry of Healthcare team was paying attention to that, but at the same time we understand that we always have a road to improve and to have more effective model. The second point, regarding the implementation of those decisions. Our agency was created last year in order to implement those decisions that were approved in the Ministry of Healthcare regarding the provision of the patients with the drugs and medical devices. And that's why I would like to say thanks to Sanofi company for correct market access. So when company got into Ukraine, not just by selling their own drugs, but also by providing the help. In case we are talking about the civilized business, that's completely a correct approach. We surely would like to say thanks for that, and I'm going to say even more. We are going to have an open proposals, and we are going to propose it's openly to all of those manufacturers that work on the Ukrainian market right now, for them also to have a more wide corporate social responsibility. Starting from the next year, in case there are going to be some changes implemented, we are going to have some amendments to law. We are going to implement this program. Thanks a lot, Arsen. Thanks for you following the agenda. And thanks to that, I know how strict you are with the agenda, and that's a tradition to follow an agenda. We are talking about the treatment, we are talking about the patients, but we didn't hear those patients, those people who are really affected by those diseases, people that are united in the NGOs that help and also irritate sometimes because they are active. It is really important or more comfortable for us that yes, okay, we have an issue, but despite the fact that we are not experts, let someone pay attention to this issue. But at the same time, when those NGOs start to be really active, we sometimes say, oh, why are you so making it as a loud issue? One of those NGOs, an organization that's, sorry to say, orphan diseases. I'm not saying that because there are some deputies, yes, so there are orphan diseases. Tetyana Kulesha, the head of this NGO. And the question to her is, so you represent the NGO which unites the patients with the orphan diseases. And for a lot of years you've been working, you have a lot of experience. So how are you going to give the description of the current status of provision of patients with the orphan diseases treatment, and what's the need in the humanitarian aid? Maybe you're going to give some numbers, statistic data, and maybe you give it just with simple words. Good afternoon. Let's fully understand, and we are going to talk professionally or by simple thing. In case we talk about as people, that's just the cry of the soul. But we've heard some combination how to give the data and also to talk it simply. Yes, the deputy of the Ministry of Healthcare. Thanks a lot to those, because that's the attitude to the orphan disease. But let's be honest with you. I would like really to say thanks to the position of the Minister of Healthcare, to the position of the Committee of Healthcare, and to the position of the medical procurement system, because that's the first time when this position is united and is united. That orphan patients should be a prioritized direction. I didn't want to wear this t-shirt because I'm tired to wear that, but that's a brand. I'm once more in this t-shirt, and for all the media I'm going to say that while we breathe, while we are alive, I'm not going to take this shirt off, and that's how I'm going to prove that this is needed. I really would like to say thanks that, being honest, for the last 1.5 months our NGO more than 36 letters to the Ministry of Healthcare, to the Medical Procurement Agency, with numbers, with flash drivers, with videos of all the patients of orphan diseases, and we sent that to the Ministry of Healthcare in order to ask, in order to make the 2020 year as the year of support for the orphan disease patients. And we'd like also to address to the media to highlight this issue, because 2002, this is the year when we are going to have the 29th of February, and 29th of February is as the day of orphan diseases. In Ukraine, we have this date on the 28th of February, but we would like really to ask you, please support the idea of the patients to make this year as the national year of support for patients with orphan diseases. Regarding the united position, I really hope that all of us are going to get to the point of the improvement and expanding the costs of the financing in 2020, but it is really an important part of provision. But despite financing, it should be a strategy developed, and we are ready to take part in those strategy development, because strategy right now is present in all European countries except 2, and we have these examples of strategies. We are ready to develop it with them. We are going to show you it. We need to have this kind of strategy, because despite the financial part, we also need to have social part, policies and humanitarian aid for those patients. The second point of your question, whether we need the humanitarian aid, I would really like to say thanks. As a mother, I would like really to say thanks to humanitarian aid of Stephanie. I know a lot of patients who are alive because of this humanitarian aid, because those patients are not observed. They are not even officially financed by the Ministry of Healthcare. The ministry doesn't know that they need to have costs to be approved. And Sanofi company is proving that we have patients with their own families right now, thanks to their humanitarian aid, and we are going to develop it further. Our main aim as the patients organization, and I'm going to address to the Ministry of Healthcare, to the committee, to have this kind of humanitarian aid program to be present not only from Sanofi, because we have a huge amount of patients, different kind of diseases which do not receive their treatment, not because they don't want to, because budgets cannot cover all the needed costs, and it is needed for them to be alive and for their lives. That's why we would really ask you, when this kind of program, I hope it is going to be a united program of cooperation between the Ministry of Healthcare and a company, for it to be included, that it should be not just from one company. That's what we really highly ask and request you to do. And by finishing, giving a conclusion to my talk, I'm going to repeat once more, we are not loved. It doesn't matter what people say about us. It doesn't matter when someone says for us not to talk. We are going to talk. We are going to stay loud, because we have our children. That's the first thing. And second point, we address Europe a lot, and we visit European countries a lot. And in case Ukraine wants to be a European country, we should to start with the priority, the life of the patient. Even in case it costs a lot, that's the priority. Orphan diseases, please, it's going to be a priority. Thanks, Tetyana. And in case we are talking about the international experience, I'm going to address to Yasmina Ahrens to give her the floor. She is an Associate Director of Humanitarian Aid Programs of Sanofi Genzyme. And the question is, regarding your international humanitarian program, what's its aim? Maybe it should be implemented in other countries too, and what exactly Sanofi Genzyme does for Ukrainian patients. Please, giving you the floor. Огромное спасибо всем. Здравствуйте. Пожалуйста, включите микрофон. Спасибо. В первую очередь хотелось бы начать с того, что я благодарна всем, кто пригласил нас. Прошу прощения, нужно выключить все-таки наушники.
For inviting Sanofi Genzyme, especially our global humanitarian program, to this special and for us very unique forum. For us as a company, humanitarian program is in our DNA. It's just something we do, have done since the first initiation or start of the treatment or first treatment for rare diseases. So when thinking in perspective, I have been involved in a program for 14 years. In Ukraine, we have been present through the program for 17 years in total, and it is something that just defines our company since the beginning or since the foundation. I would not be able to speak about other companies or their contribution to rare disease patient population, but I would like to say that for us, it has always been something that we consider to be the right thing to do. Our company does not cherry pick where we would like to support patients. This is done based on a globally developed medical criteria, and patients have been, or currently are, more than 900 patients across all the diseases that we have in the program as of today. We treat across 6 continents, offer 6 disease treatments for 5 rare disease patient communities. It's a privilege and honor to call the program not necessarily just, it has a goal, and the goal is to deliver to the best of our ability, support for rare disease patients in a need where access to treatment is otherwise not available. Ukraine is not alone. It's not the only country that has an issue. So in most emerging and developing countries, we have had or still have challenges with product not even being registered, let alone reimbursed. And then when it comes to the state funding and complexity of lack of the funds, then it gets even to be even more challenging. As of today, we have had more than 3,500 patients who have gone through the program. We have more than 65 countries offering or in a program as of today. And the value of donated product per year is more than 20 million euros for all diseases and active patients. I would like to say that historically, specifically for Ukraine, with every introduction of a rare disease treatment for rare disease patient, we have also made sure that the product becomes available to patients. Because essentially what's the purpose or point of the development of the drug when it doesn't have access to patients who need it. For Ukraine, it's quite fascinating to see that thank you to the physicians who are qualified experts in their fields, they've been able to diagnose, confirm, and include patients and get them early access to treatment way before it becomes registered, reimbursed, recognized, or funded by the state. So in Ukraine, this has really meant an incredible achievement for early access to patients who otherwise would not have it. For us, we consider ourselves direct partners with the whole community. There is a saying, it takes a village to raise a child, and for Sanofi Genzyme, it's not just the business that is here. We take our role in patients' lives in this activity seriously. Patients are obviously having the direct benefit from having early access to treatment. But we'd like to say that none of this would be in place or programs would not be as effective if physicians were not dedicated, directly involved, or if this partnership in general was just between the business, or let's call it the private sector, patients, patient associations, or physicians. We take partnerships with Ministry of Health seriously, and it has been a partnership that has been present since we started importing the humanitarian drug. Sometimes inquiries do not necessarily come from patient associations or families. Ukraine is also one of the examples where inquiries for support have been given to us by the ministry directly. In terms of the diseases, I would not really go into details, but in the spectrum of the diseases, the highest number of the patients we treat through the humanitarian program is the Gaucher patient community. That is globally when looking on all the countries that we have the humanitarian program. It's really split in terms of how many patients we have between Africa and Asia. In Ukraine, or Ukraine for us falls in the Middle East or Eurasia markets. It is the market or country with the highest number of patients in the humanitarian program, and that's followed by Jordan, Palestine, Pakistan, and so forth. So really in a global spectrum, there are patients who have been on humanitarian treatment for many years. This is a process where in parallel and while they are receiving treatment, our company is supporting government officials and state departments in a way to try to find a sustainable long-term solution for the patients who are in the program today.
1 minute. 1 minute left.
Okay. And last one, perfect. So in terms of Ukraine, like I said, it's in terms of numbers, the data that we currently have as a company is that more than almost 50 patients have received humanitarian treatment, either approved and just getting access hopefully soon, or have been in a program, and some of them for more than 17 years. For us, we recognize the importance of early access, and it has been our mission, our goal, our vision to support patients who otherwise cannot have access to treatment.
Дякую, thank you very much.
Thanks a lot. Thanks you a lot. And right now we are going to have a talk from the physician, Natalia Samonenko. She works in the Okhmatdyt clinic, as far as you know. Please give your comments regarding the situation. How easy it is, how easy to have the financing of the orphan diseases drugs to receive the help. And Okhmatdyt is the clinic which receives this help and gives and works with those patients with orphan diseases. It was mentioned by Deputy Bulakh whether it is really important for the patients to receive those treatment. Good afternoon. Thanks a lot for this invitation. Thanks for this question. In fact, Okhmatdyt Clinic is the biggest clinic which is involved right now into the process of diagnostics, treatment, and screening of patients of any kind of orphan diseases. And despite the fact that we've heard a few times regarding the absence of the register of the orphan patients, I'm going to say personally that we have patients report, we have a report from Okhmatdyt Clinic regarding the amount of the patients that receive humanitarian aid, and so on. Just part of the patients, of orphan patients, receive the treatment right now, and even less patients receive those drugs thanks to the budget costs. And with each month, we have a positive tendency that the amount of those patients are improved, and even diagnostic procedures are better right now. We have new patients diagnosed, new drugs are involved into the clinical trials, and of course all of those need the additional financial support. And it's not a new scene for us that these drugs are really expensive, that we cannot buy those kind of drugs out of the pocket. We even have the lifelong treatment for some of the patients, and any patient cannot do it. That's why there is a huge role for those companies that give us the possibility to receive those treatment thanks to the humanitarian aid programs. Especially when we are talking about the extra or really fast start of this therapy. We really know that there are a lot of diseases which should have an early access of the treatment. And of course we know that the general procedure right now of the procurement is that in case the patient has the possibility to be procured, it might be started in 6 months after the diagnostic procedure, but in most of the cases it is done in 1.5 years from the diagnosis, and this patient was included into the procurement system to receive the drugs. So in those cases, companies have a huge role that help us with their humanitarian aid. This, for example, is, so to say, bright example. When the first patient with the syndrome with the POMP disease, there was a girl who was diagnosed. She should have died starting from the first year of life. But she started in 2 months as the treatment, thanks to the Sanofi Genzyme company, who provided this help to the patient. And patient received those treatment. And the help from the public, from the government, she started to receive just in 2 years after the establishment of the diagnosis. And this girl is right now going to be 6 years old. And in case this kind of treatment would not be prescribed and would not be given in time, this patient would die just in a few first months after the establishment of the disease. And of course, I personally, as the physician, is highly curious that we know that the humanitarian aid cannot be consistent, cannot be for the whole period of time. These patients receive this humanitarian aid for years. You've heard it today. It may stop at some point, and I am afraid that at some point someone is going to say, oh, you know, we are not able to give these drugs for free. And of course, there is a huge role from the state point of view, which should provide treatment to those patients for the budget costs. And this is really extremely important for patients and for the physicians who observe and who manage those patients, of course. And of course, Sanofi company, we know that we have some patients that receive the humanitarian aid for 15 years. That's too long as for the humanitarian aid, for sure. Thanks, Natalia. When this kind of people, as Natalia Samonenko, say that I am afraid, I think that that's incorrect word to say it. You are not afraid. You and other people who are here, you are fighting with what is going on. And this example that you've shown regarding the help that patients have additional years of living, even in case this patient might have died. That's one of examples that we are talking about, not fear, about not being afraid, but about your bravery and the possibility to fight. Mykhailo Martynenko, as far as I suppose we've seen your portrait and your photo on this Sanofi Genzyme, please give us your story. For how long do you receive the humanitarian aid? And what's your possibility to get this treatment from the budget costs? Good afternoon. First of all, I would like to say thanks, huge thanks to Sanofi Genzyme company that in spring it was 15 years that I received the enzyme substitutional therapy thanks to the humanitarian aid. Also, I would like to say thanks to the physicians of the Orphan Center of Okhmatdyt clinic, that these people, they are really fighting for us. Each time they phone us, they ask how do we feel, how do we as the patients feel ourselves, because it has been for more than 15 years. I was diagnosed with the Gaucher syndrome in 2015. In 2004 I started to receive, thanks to the Sanofi Genzyme company, the humanitarian aid. And I know that for the last few years, my physician, my genetic, the main genetic in Nikolaev region, he addresses me as the physicians from the Orphan Center in order for me to receive the procurement of the drugs, Syrazine drug, for the budget costs. But we have just one answer, that we lack costs. And thanks to this company, I continue to receive my treatment. I would really like to say that my parents had a really long way when they were just addressing all Ministry of Healthcare doors. I think as all of those parents of orphan patients. When in 2001-2002 they was said that for these costs that your patient is not going to get cured and this disease is not getting cured, for these costs you may cure 5 oncological patients. And the question was whether to live or die. The answer was to die. And today I've heard from political representatives of our discussion a lot of information and a lot of perspectives, clear ideas, events, measures. And I would really like to believe and hope that these words are not going to be just words, and they are going to be really implemented into actions. As it was already mentioned by Natalia, I'm not just sure, I know that those people, the specialists from the Orphan Center, they have this register of the orphan patients. And I know that it's just not an Excel table. And this is really deal. And it is really separate patient's history. That's why to use it as the part of the Ministry of Healthcare, this is just a personal approach to the Ministry of Healthcare representatives. That's why I'd like to say thanks to Yasmina a lot. I would like to say thanks to all other people from Sanofi Genzyme. We have a lot of them. There are a lot of those people who we know, who supported me. I met with those people. That's the representatives of other countries too. Thanks to the Sanofi, I got the possibility to get familiar with a lot of patients with the Gaucher syndrome from other countries. A lot of interesting things were mentioned regarding how therapy is going on in other countries. And I would like to say thanks that Ukraine has some way to be improved. But we do not have the worst situation. But still, I wish and I would like for the government in these 15 years... Sorry, I've been ill and I've been living with this diagnosis. We have the 5th president changed. And the amount of the prime ministers, I cannot even count out the amount of those who changed. This company, Sanofi company, as was treating me, it continues to treat me. And that's everything we need to know from this cooperation of business and government. I don't know any kind of other those companies. I cannot afford those drugs. Even in case I would like to afford them, I cannot just address the pharmacy to receive them. That's just impossible. And the only words that I have is huge thanks. Huge to all of you. Thanks to my parents. Thanks to Tetyana. Thanks, sorry for saying that, but she's fighting every time when we have any kind of issue regarding the orphan patients. Thanks to all patients with disease the same that I have. Thanks to all of you and also the physicians, first of all. Thanks a lot, Mykhailo. And I have an additional question to you. Give us like in 30 seconds, not about as an orphan patient. Not in this context. Everything is normal. I'm an ordinary person, thanks God. Thanks. Maybe you like something, hobbies. I'm 30 years old. For 15 years I received the humanitarian aid. I'm a lawyer. I work as a lawyer. I have a wife. She's also a lawyer. That's also paradoxical. Yes, 2 lawyers. Yes, 2 lawyers, 3 opinions, so to say. Everything is ordinary. I have family. We plan to have children. Thanks to physicians that supported me in each issue. It doesn't matter what kind of question I might have. They answer everything. Thanks to Okhmatdyt Clinic. Thank you. Yeah, thank you, Mykhailo. And from lawyer, we are going to move to lawyer, Maryna Slobodnychenko. We've heard and we know that we have this kind of the business cooperation de facto. It exists de facto. But the cases exists de facto. In case someone would like to demolish it, to damage it, it might be done because it is not protected by law from the legislative point of view. So, what kind of possibilities we have to implement it into the legislation in order to guarantee that this kind of cooperation in one or another way around is not going just to be supported but also going to be developed and going to be spread. You know, you've actually covered a really nice topic we are talking about the cooperation in the orphan diseases and also the humanitarian aid environment. I would like to say the next things, that in case we're talking about the classical cooperation regarding the humanitarian aid does not exist. That's just a voluntary scene, so to say. That's just a partner's help. This is the one-sided game. Cooperation might be done, but it should be present in those situations. And this cooperation means and is observed from everything that was mentioned only from the point from the company which provides really powerful costs to the orphan patients. So what's the other side around of this cooperation, so to say, from the governmental point of view? Was the cooperation from the government? It was also mentioned. Thanks that the Committee of the Healthcare of the Nation is highlighting this issue. First of all, that's the register of the patient, a strict strategy development for the orphan diseases, the strict budgets which should be followed just for the orphan diseases, and the cover of these taxes should be done using the sources. By what kind of sources this coverage of the taxes should be done? It might be, for example, the social risk business. For example, the legalization and implementation of businesses. And that's how you're going to address those taxes and expenses to these needs of orphan disease patients. But there is another way around. I'm just a legislative, pure legislative. As the classical cooperation between the government and the business, it should be present. And it was mentioned by Natalia, the physician from Okhmatdyt. She mentioned that the humanitarian aid is not for the whole time, is not the lifelong. And the aim of the country is not to ask to receive the humanitarian aid, but there should be a feedback. Let's find out some cooperation points in which the humanitarian aid is going to be decreased, but this is going to be transferred to any kind of other social support for the patients. For example, the classical cooperation is the concession. What do I mean by that? Right now, we have a really nice mechanism which might be implemented in the sphere of DPP when the manufacturers or any kind of other investors in the healthcare invest their finances in diagnostic centers where we might reveal on the early stages and to diagnose the orphan diseases. The medical guarantees program, which is implemented and should reimburse those costs to the investor. So, by realizing in this healthcare facility this classical business governmental cooperation, it is a concession or another way of cooperation. For example, on the 3rd October we have a new law taken regarding the concession. That's just thanks to the government. Yeah, thank you guys, you are great. And it actually gives us the additional guarantees for investors, and it gives the possibility to have the new concession as the service provision regarding the diagnostics, for example. This is what we might use in our topic. That's why I would like you to pay attention that you need not just only to talk about the extra expenses, but also regarding the possibilities of other cooperation between the business and healthcare's private partners in order to help the patients with those diseases and in other kind of spheres, not just by the provision of the medication, but also regarding the diagnostics. Thanks, Maryna. I'm going to remind you that Maryna was one of those who was in the author of the recommendation of the guidelines of the Ministry of Healthcare in this sphere. Lada Bulakh, when she was talking about the concession, she immediately said, yeah, this law is already approved. And by not hearing that, Maryna also mentioned that it means that we have some people which are united with the same aim, which know what's going on right now in political part, as was mentioned by Mykhailo, and also in the practical part. We have just 15 minutes left for the Q&A session, for questions and answers. And in case we are not going to have questions from the media, from the audience, I'm going to ask questions on myself. Please, who would like to ask some questions? You are welcome. Good afternoon. First of all, I would like to say thanks for inviting us on today's event. My name is Elena Martinenko. I am the head of the NGO of the patients with Gaucher disease, and also I am the mother of this child. I would like to ask Mykhailo Zahriychuk. We were talking a lot today about the register of the orphan diseases, that without creating this register, it is impossible to cover 100% of those patients. I would like to ask, what kind of steps have you already done as the Ministry of Healthcare in order to create this register? Thanks for this question. First of all, I would like to say thanks for your active position. Right now, for 1 month, in the Ministry of Healthcare, we were analyzing not just orphan diseases. And the result is what I've told you and what I've reported. We were evaluating 4 or 5 meetings just dedicated to the further strategy of treatment of the orphan disease patients. Because orphan diseases, that's not just investigation. This is a process. This is the treatment process with the constant evaluation. That's why right now we have an aim, we have a purpose to have the institute of the experts, and in this structure we are going to have one person with who all of you are going to work with. So to say, the responsible expert is going to be a physician who knows how to do the treatment, for whom we are going to have a name to make the register, to have the national strategy of management of this kind of patients, starting from the diagnostics procedure, up to the treatment, up to the analysis of the results, up to the modification, depending on the scientific approaches. To name when it is going to be done, I'm not going to say that, but that's together with the transplantation is the main priorities. The strokes, insults, myocardial infarction, orphan diseases, transplantation, this is a social sensitive project. And that's why we have some group of experts, and we analyze and evaluate those experts who were the people who were taking the strategies before, up to this point. And we are going to support those experts with real professionals, with physicians. I have a huge respect that we talk with the same words. In case you treat the patient, please help us. And you're going to be an expert. This is the one main aim. And we are going to be successful with your support too. Thanks, Mykhailo. You have another question around. Yes, just another question, 1 minute, please. I would like to say thanks to Sanofi Genzyme company, which started from the 2002 provides the treatment for the Gaucher syndrome patients. In 2002 it was 1 patient. Right now we have 15 patients. And as it was mentioned by Tetyana, the Minister of Healthcare doesn't see our patients, doesn't observe, but right now they are present in the audience. Not all of them had the possibility to visit this event, but I would like our patients to stand up in order to the Minister of Healthcare to see them. Please. We do not have a lot of these patients, but we are going to fight for each day of our life. And it is the bright example of the humanitarian aid and treatment that's mother with the small child. That not just one child that was born among our patients. That's why huge thanks to Sanofi Genzyme company, as from the NGO part, but also from as a mother. Thanks. Thank you a lot, and thanks for the patients. Yes, of course. Our dear patients, first of all, I would like to say thanks for the position. I would like to say that your approach, I'm a surgeon on my own. And I also have patients. It's not just the orphan disease, but pancreonecrosis patient. This is a really rare disease for which we have a really expensive treatment. And the mortality rate is 80–90%. And when I hear that, we do not have a lot of patients and we need a lot of money, let's just close our eyes and invest into more social diseases. I, as a surgeon, I do not agree with it. And up to the moment that I am going to be the deputy of the Ministry of Healthcare, this kind of policy is not going to be implemented. I do not promise anything. Understand me. Ministry of Healthcare is not the institutions that might solve all the issues right now, but everything that should be done from our team. I tell you on the rights of the Ministry of Healthcare, we are going to do everything, and we are going to meet in 1 year for you to say that you really help us. Thanks, please, Lada Bulakh, you're welcome. And I promise, I'm giving a promise. I would like to promise that I personally, I'm not going to emphasize, but I'm going to use any measures together with you in front of Cabinet of Ministers, in front of the government, in front of the office of the President, that I'm going to fight for that budget in order to provide the physicians and patients. Because this issue is not only our problem. Each physician which understands that he or she as a physician cannot save the patient is also unhappy, and that's why we need to help to have this cooperation between patients and physicians in order to preserve life and not just to wait when there are going to be any kind of the new team of the Ministry of Healthcare appear or another business which are going to have this humanitarian aid. But for us to understand that government, this is a service which takes a really simple and understandable decisions, and physicians should not seek for and search and to involve the representatives of the pharmaceutical companies in order to provide the drugs to the patients. And for the physicians, just to know that there is the Department of the Ministry of Healthcare, there is the Ministry of Healthcare, and this is a united team which has the resources and has the wish to provide the patient with needed drugs and treatments. And in fact, as the conclusion, I'm going to say that we have a really unique scene. This is the first scene, the first time, so to say, the historical period when the Parliament and our committee and our department has the full consensus and unite meeting. We have the same priorities. We meet up not just on these official meetings, we visit different kind of meetings. We support each other. We are, of course, the subject of the lawyers' initiative, but we cannot use the information as soon as which is observed by the National Healthcare Center as the medical procurement, as the Ministry of Healthcare, and the processes that cannot even imagine how do they change and how this data is changed. Ukraine, firstly, uses new approaches in financing the medical services, in the procurement of the medical drugs, and also the cooperation between the physician and the patient during the next year is going to be really, from the spacious point of view, is going to be really new one. Not just to see, it's going to be digital too. And the medical history is going to be available not just to your physician, but also in the Ministry of Healthcare, and probably for me as a deputy when I'm going to be interested in this medical history. That's why I'm going to do everything for the budget to be the priority right now in the program. Thank you. Thanks. Lada, any kind of other comments, questions? No. I have a question. I have a question to Yasmina Ahrens. I was always a little bit worried regarding the best of our ability formulation, because a lot of people might have different kind of imagination regarding what's our possibilities, what kind of options we have. So how often do you, when you provide this humanitarian aid to the best of your ability, you hear from others, no, you do not give this the best of your ability? And how often do you think and say, oh, our possibilities are bigger according to this? And how often do you start to work on the new level, so to say? Please, giving you the floor.
I'm not sure I understood the question fully.
All right.
But,
I'm always a bit slightly taken aback by the...
Прошу прощения. Вы часто используете слово «лучшее из ваших возможностей», потому что наши идеи, наш доступ, они отличаются от идей других людей. Как часто вы получаете мысль о других людей, что вы не работаете.
And how often you say to yourself, listen, there are new abilities and new capacities that we might build on.
Certainly, that's a great question. I think the part of the best of our ability refers to we sometimes operate in emerging markets where we're not present as a company. That was the case for Ukraine even 15 years ago. So to the ability, it's just difficult to be donating to the baby in Rwanda, to the 3-year-old boy in Sudan, to the markets where we are not physically present. You have to figure out how to import, you have to figure out logistics, so we're not familiar with operational part. Sometimes people will say it's easier to sell than to donate, because to donate, there are so many logistical processes, even approvals from the ministry, custom clearances and so forth. To answer the other part of the question, we can and should and have to do more. But on the opposite side, as a company, we are doing the best we can. And certainly it would be great if other companies would be joining the platform to support the rare disease patient community. There are so many patients that deserve help and shouldn't be left alone. So,
in other countries that you work, how many times businesses or Sanofi Genzyme comes to the government and says, we can offer you this and this? And how often does a government address you saying, we know of your vast international experience of humanitarian help, could you help us?
For us, the process really comes from the treating physicians. We, as a company, do not go to the government. So physicians going back to the registry or the families. So we learn, as a company, we'll learn of patients through families and the treating physicians. So that's what initiates support, and we would know from the government if there is no registration, no possibility for state funding, and that's when physicians proceed with applying for help and support.
Thank you for sharing your experience with us. Це справді дуже важливо.
In fact, yes, it is really important. It was already mentioned that Ukraine, in case it moves to the Europe, it seems like Ukraine is moving to the Europe and not just to the Europe. Arsen, please, you would like to say a few words? Okay, yeah. In any case scenario, we may see that the person is actually thinking what we were talking about. Any kind of questions, any kind of comments, proposals? Then I'm going to have a proposal after we are going to hear the last comments from our participants of our discussion. You know, I had some comments and some notes, and the first was the phrase of the deputy of the minister, Mykhailo, when he said that it is a catastrophic issue. And I thought, whether it's catastrophic? No, he used a really interesting, catastrophically important issue. And that's why I would like to ask Mykhailo, please give your comments regarding this catastrophic important, and which kind of scenarios we might provide more possibilities in order to be not so catastrophic. Thanks for this question. Thanks, Andrei. I'm not for that long period of time a politic, that's why I'm not given the correct words. But it's really important. But this phrase I'm going to support, it is catastrophically important. The issue is that the indicator of the level of the social support and security of the population, the indicator in general of the quality of government, I don't know whether it's correct to say, but the indicator of the quality and the attitude from the government to the patients, to the people, that's the level of the health care for the population. The term is not really correct, but the level of satisfaction by patients of the healthcare system. And we fully understand, let's be honest, we fully understand that to treat most of the patients that are present right now, like, for example, the acute respiratory diseases, appendicitis, cholecystitis, sorry to say, we somehow may treat it. It's incorrect to say so. But to treat an orphan disease, where we have 100,000 hryvnias spent per 1 month, I don't know what kind of family should have it. Only oligarchs are able to afford it. That's the role of the country. That's the role of the government. So I, as the representative of the Ministry of Healthcare, I want to have just really nice understanding, getting back to register, that today we have 100 patients. They are covered by the costs for this kind of percentage. Business governmental cooperation, this is the percentage. But for us to understand that we help, this is our function. This is really catastrophically important one. Thanks a lot. And the next phrase that I would like, and I notated, that's what we've heard from Lada, the right to be alive. A lot of people were reacting to this. This is what was really mentioned. And in the end, I would like to ask you, not just saying that this is the right for be alive, just to say one phrase. The right for life is, to give a comment, what is the right for life for you, personally? For us to understand how it differs. Please, Lada, you're going to start. The right to be alive, to live, this is not the choice. What kind of life is more or less important? It doesn't matter what kind of prognosis we have, 1 day, 1 month, or years. This is the right for me. Natalia, please. For me, as the physician, the right to be alive, to live, that's an affordability, sustainability, and to improve the quality. Thanks, Arsen. The right for life, that's what population has to have a consensus about as the priority. Mykhailo, I'm going to repeat. This is the level for the possibilities for everyone to receive an expert medical services. Maryna, please. The right to be alive, this is a social responsibility. Yasmina, Ahrens, what is life for you?
For me, it's also the right for life is to have an equal opportunity, to have the right to get the treatment you deserve.
Tetyana Kulesha.
Tetyana Kulesha, please. For the orphan patient, as in any European country, the right for life, that's to be the priority in the healthcare and in the partnership. Mykhailo Martinenko, please. For me, the right to be alive, this is the part of the public cooperation between the government and a citizen that should be implemented from both sides. Thanks a lot. Thanks a lot for you being honest. Thanks for you that we've heard the stories, not just from Mykhailo, but from each thesis and from each talk that was given by the ministry, by physician and other people. We have stories. How long it is going to continue these stories and what kind of future are going to be. It all depends upon those who meet here and upon those who were paying attention to this translation, who are going to read those materials, and depending on that and how honest we are going to tell about all of those stories lately. Thanks for everyone who was participating. Thanks to Ukrainian Media Crisis Center. And we have 7 minutes left. According to our agenda, it should be enough for all of us to move those who would like to get to the first floor and to treat there. Thanks a lot.